It gets full. All right, I definitely got that on tape. Good. When you're ready, folks.
See, this magnificent creature is the Israeli deathstalker scorpion. Commonly found in the Middle East and Africa, it is considered one of the most dangerous scorpions with highly toxic venom.
This highly toxic venom is one of the main components of our drug, BLZ 100, also known as tumor pain, which treats glioblastoma.
So what is glioblastoma and why is it important? Glioblastoma is a highly malignant glioma, which is a cancer that arises from the supporting tissue in the brain. It is very fatal and very malignant, and as you can see, it has a recurrence rate near 100% and an average time of survival just a little over a year.
That's between diagnosis and death?
Yes.
The current treatments for glioblastoma is surgery, radiation, and chemotherapy. Radiation and chemotherapy are often used after surgery, but they're not as effective because they cannot bypass the blood-brain barrier. So surgery is the most common and most effective way of taking out the tumors of glioblastoma. There are many risks of surgery for glioblastoma because, first of all, the surgeon, when they're looking at the brain, they can't differentiate between the tumor cells versus the healthy brain cells. And they're basing off their surgery off this MRI that they took of the patient's brain for 2 days before the surgery. So they're looking at a picture from before and they're taking out the tumor. Because they can't differentiate between the cells, they often take too little or too much of the tumor. The problem with taking out too little of the tumor is that there's tumor cells left, so then they can metastasize. The problem with taking out too much is you take out too much of the healthy brain tissue, and the brain tissue, as you know, is important, and it can affect movement and speech. So imagine waking up from surgery and not being able to speak.
So that's where tumor pain BLZ 100 comes in. So what is it exactly? It makes the tumor it makes the tumor light up, so that the surgeon can actually see where they're cutting and more precisely and more completely take out the tumor without affecting the surrounding brain tissue. It is injected through an IV, and one of the reasons this drug is so revolutionary is because it bypasses the blood-brain barrier. The blood-brain barrier is a sort of filtering system between the blood in your body and the blood in your brain, so that toxins or fluctuations of hormones and other blood does not affect the brain and damage the brain. So scorpions actually evolved to bypass the blood-brain barrier with their venom, and that's one of the reasons BLZ 100 is very revolutionary. Just one thing to make really clear, BLZ 100 is not a cancer therapy. It does not reduce tumor size. It does not kill cancer cells on its own. It is actually a surgery aid, so it helps surgeons more precisely take out the tumor, but on its own it does not affect tumor cells.
So we have an activity for you guys to try out to see how surgeons see it.
Mm-hmm.
So you guys split into 3 groups somehow.
Maybe like each bench or each row. And everyone can just gather.
Yeah. So, maybe. Yeah. Sorry. So, can you think of this jar? Don't open the jar, please.
Yeah.
So think of this jar as a brain, okay? And the tissue inside is brain tissue. And there's a tumor inside, okay? Can you guys find the tumor in this jar with white light?
Just try looking around for it.
And like, if you can, then great, but like, is it clear?
it clear?
I see it. I see it.
Okay.
Good.
Good. I'm glad you can see it because you're a great
I
sister.
don't see it.
Great. Good. Thank you for
I can't
going
find
with our
it.
presentation. Thank you. Okay. Ready?
Remember
Okay.
what you see.
So turn on your black
I
lights.
don't see it.
Please,
Remember
Yep.
what you see.
Okay. I'm turning off the lights.
And not
Thank
the
you.
way you see it.
You're welcome. Okay. Look with the black light and see if you can see the tumor clear.
And you can see a little metastasized
Glowing.
over here.
Right?
So you
That's
couldn't see
basically
before.
what BLZ
So that's what
100
BLZ
does.
Yeah.
Where
Where are the other ones?
Can I see it?
Jackie, is
And
the
then you
tumor
can see, like, over here, there's a
derived
metastasized
from the black light? Or
No, the
is it
tumor paint is derived from the sort.
So do you need the
It's
black?
a chemical?
Will you need the black light to see it in like
this
like
is
the
the
operating
actual-
room?
No, but
Yeah,
is
we
it a
need
chemical?
a special light that can pick up the fluorescence.
So
We'll
this is-
we'll explain it later.
Explain that in a little
You
bit.
paint the tumor and then you see the light on. Wow.
No, we're
No,
trying to say that
BLZ
in fluorescence, basically.
BLZ is the highlighter.
So it all-
Hey Wallace, can you move that chair?
Yes, it allows the tumor to light up, to be lit up when it's excited, but we'll explain that in a minute.
So that would probably be what surgeons see.
This is a mouse brain, by the way. So BLZ 100 is made of two components, chlorotoxin, which is derived from the scorpion venom, and ICG, which is a fluorescent molecule, or a fluorophore. So the way we like to think about it is chlorotoxin is sort of like a GPS. It finds the cancer cells and binds only to the cancer cells. And then ICG is the glow stick. So it is what makes the cancer cells light up. So together, BLZ, which is made of these two components, can find the cancer cell, bind to it, and light it up.
Yes, Jack.
Do you know how the chlorotoxin only binds to cancer?
Yes,
Yeah,
we will explain that in a second.
So, make sure we get into it. So chlorotoxin's job is basically find the tumor, like Namita said, and it does this by binding to MMP2, a receptor on glioblastoma. So as you can see from this Western blot, MMP2 is only found in glioblastoma cells. So astrocyte is a control, which is a normal, healthy brain cell, and D54MG is a glioblastoma. Okay. So MMP2 is concentrated in glioblastoma cells and not astrocytes. And they determined that 78 kDa is an MMP2 specific. That makes sense.
Is glioblastoma only brain cancer once it's progressed to a certain point, or is it all brain cancer in that? It is brain cancer once it's a grade 4 glioma, so it's like a very highly malignant version of the glioma. Yes, it's only like one stage. It's not.
You just like sorry, can you repeat what that is? Like,
It's a control, so it's just a normal healthy brain cell.
So does the chlorotoxin only bind to MMP2?
Yes.
So this is just showing that MMP2 is on glioblastoma cells. Okay. So chlorotoxin binds to glioblastoma cells. I'm not saying it's binding to MMP2 yet. Okay? So again, astrocyte is a control. D54MG is a glioblastoma cell. This is an overlay with chlorotoxin, and it was found at 78 kDa. And if you remember from before, MMP2 was found at 78 kDa. Okay? So this is just showing that chlorotoxin binds to glioblastoma cells at 78 kDa.
What is 78 kD? Is that on the DNA strand?
It's MMP2.
But
It's
like
like a
what
type of MMP2.
type of MP2? But where is it?
on the brain side.
Yeah, on
Yes.
the brain cell of cell membrane, of the receptor.
Glioblastoma cell, not a healthy cell.
And this is just like a clear version.
What is that experiment they're showing you today?
This one? That chlorotoxin is found in glioblastoma cells.
Is it
It's
also
like specifically
Yeah, it
binds
is.
to glioblastoma. Okay, sorry. So this is showing that if you like go up that way, MMP2 is specifically bound. Chlorotoxin specifically binds to MMP2, but not other MMPs. So does that make sense?
Anyone have any questions?
Yeah, so there are different isoforms of MMP. So since MMP2 is only found on glioblastoma cells, this is just showing that chlorotoxin binds to MMP2 only, and not isoforms of MMP.
Is there anything else that binds to MMP2?
Yes.
What is the bottom showing there? Why is
This,
it dark?
that MMPs are there
Oh.
to test it's like yeah.
So ICG is the other component of BLZ, and while chlorotoxin finds the tumor and binds to it, ICG is what lights it up. So when it's excited by photons, it emits light in the near infrared range, and as you can see on the spectrum, the infrared range is actually outside of the visible light spectrum, so you can't actually see it without help. And that help is in the form of NIR imaging, which is a process of here. So just to give you a quick step-by-step of what would happen, BLZ 100 would be injected. Chlorotoxin would bind only to the glioblastoma cells, and so that the fluorophore is only on the cancer cells, not on the healthy cells. And then the NIR light source, right here, would excite the fluorophore, which would then emit light in the near infrared range, which can then be picked up by this camera, okay? And then it is displayed on a screen so that the surgeon can see in real time where they're cutting. Any questions on that?
So the chlorotoxin is what they're deriving from the scorpion venom?
Yes. The ICG is just another molecule that's attached to it.
Any other questions?
What did you say the chlorotoxin does in the scorpion?
Oh no, it's just it's derived from scorpion. It's a peptide that's derived
From scorpion venom.
Does it make scorpions glow at all? I'm just wondering.
No. So chlorotoxin isn't what makes it glow. So chlorotoxin is separate and it's derived from scorpion venom, and then ICG is another separate molecule. Chlorotoxin does not have any properties of fluorescence. ICG is the one that has fluorescent properties, and it's attached to chlorotoxin.
Any other questions? Can someone summarize what we basically said?
The basic mechanism.
Okay, so there's a chlorotoxin derived from scorpion venom, and there is an ICG, which is basically something that stains a molecule to make it appear under infrared imaging. And they put it together, and then they inject it into the humans, and the chlorotoxin binds to the MMP2, which is found on brain cells, the receptors of the brain cells, and then glioblastoma cells, my bad. And then they can put the infrared light over the general area, and then they can find the tumor using infrared imaging.
Very good.
Yeah. So like Belinda said, surgeons can see in real time during the surgery where the tumor is through BLZ 100 and NIR. So this reduces the risk of taking out too much or too little, because now surgeons can differentiate between the tumor and the brain cells.
And this is especially important in glioblastoma, which is a cancer where surgery is pretty much the best and most effective treatment. So the next step, BLZ is just got approved by the FDA for clinical trials. So there's still a long way to go before clinical use, and hopefully clinical trials will answer some important questions about how BLZ works in humans.
Thank you so much.
So as of right now, they don't know any side effects from the drug.
Yeah.
Did they ever consider using the chlorotoxin as like a vehicle for toxins instead of just for fluorescence?
Our drug is specifically applied to tissue.
Yeah. Maybe that's the next step. We don't know yet. They didn't go into that. Sorry.
I bet you surgeons actually said that it helped them in practice.
It hasn't
been ever
used. No.
It's starting in clinical trials in 2016.
So do you think that because it lights up a tumor in the body, it can be used as a possible detection method of glioblastomas?
It is.
I mean, other than just for surgery.
Oh yeah.
I think, yes, I think it could. We have to see obviously the side effects, and whether it's worth doing that to like protect it.
Is this like an expensive method to use for this?
I don't think they have a price or anything because it's like still developing. So
But I'm assuming it is.
it's gonna be
It's expensive. Obviously, the need for an NIR imaging, the whole system. Yeah, the whole system.
When they check in binding, did they just check in the brain cells or did they check in the entire body?
they all check
Do you know if there's any method right now besides this one that can reduce the risk of sending out too little or too much tissue in the brain?
Right now, I don't know of any others.
only one.
MMP2 is found only in glioblastoma cells, correct? So then, what is the purpose of MMP2 in the tumor cells, and why is it not expressed in regular cells?
It's actually a matrix metalloproteinase. This was actually in hallmarks. I don't know if anyone caught it, but it's a matrix degrading enzyme. So it's involved in metastasis and invasion. So there's studies going on right now of whether the inhibition of MMP2 could actually lead to a slowing down of metastasis. We didn't want to include that because no one's 100% sure. So they're studying that right now, but yeah, that's why it's up there.
So, I mean, if it's part of the glioblastoma cells, is it not a part of other cells, or is it just a mutation that is what allows the chlorotoxin to bind to?
It's just a receptor on the glioblastoma cell. Also, I think it's that specific type of NMP2 is upregulated, whereas it's not really on astrocytes, which you saw in your data.
Oh, I hope this doesn't sound relevant. I don't mean to, but why should this be important to us?
Okay, so basically, like I said before, if you take out too much of the brain tissue, obviously it's not a good thing because if you impair I don't know if you watch neural health, like certain brain tissues like have certain functions like decision making, movement, speech. So obviously, if you take out too much and you take out like even like one cell of the brain tissue, that can impair
Because it damages the brain, and there's lots of different things that happen from that.
where it helps them see exactly where instead of like not guessing, but like basing off of.
Also, as you saw in the activity, you can see like little metastasized bits that you might not have seen before, and that's true in active as well. The MRI does not detect everything.
I might miss this, but how is it administered? Is it like, would they do surgery on metastasized bits as well if they found them?
The surgeons do something?
Yeah, it depends where the metastasized bit is, like in the brain.
Do they know like how long after it's administered before it starts accumulating?
I know it's just injected like for adults undergoing surgery, so I think we lost
Multiple days.
yeah.
They did an experiment with dogs, I believe, and they administered it. They did two experiments. One they administered it 24 hours before, and then one 48 hours before. But I have no idea about humans. Sorry.
Are there any side effects of the injection?
So much human MP2, and so glioblastoma is only a high grade malignancy cancer of the brain. So will lower grade malignancies of the brain not be recognized by the tumor type? We don't know. One of the reasons that it's used specifically for glioblastoma is because it's so invasive and malignant that surgery is probably like one of the only options. Whereas like a benign tumor, it might be easier to take it out, so they might not need BLZ 100.
Are there any other cancers that upregulate FMGC?
We don't know yet. The paper didn't go into that. They didn't really research that, but I'm sure there is a possibility that this technology can be used for other cancers.
So like, isn't it be like everyone in the room, obviously most of your brain function normally? How does having surgery to have this tumor removed, how does that affect somebody?
Can you repeat that a little louder? Can you repeat that a little bit louder?
You said like taking out these ones off the damage your like components of the brain. So how would like how does taking out this tumor affect
The tumors on top of the
Okay, sorry. Obviously, any surgery where you take out the tumor has high risk. So I'm not completely sure, but I guess it's better to take out the tumor than to leave it.
So that's it. Thank you everyone for listening. Do you want to use this? Like, do you want to keep this up?
Sure.
Okay. Password's D. Sorry.
Who wants to be the person? No. Two people. I mean, thanks for volunteering. I can feel it. What was the scorpion?